Not this week.
Thank you.
Not this week. We're good.
All right, that's going to do it this morning for us here. Have a great day, and we'll see you tomorrow. Same time, same channel, same place.
Would you settle for a little bit of whip when you could have a heaping mound of it? Would you settle for someone who's really into you, but like emotionally unavailable right now? Would you settle for your new furniture being delivered like this? At Wayside, we believe that some things just weren't meant to be delivered in a box on your doorstep. Don't settle. Choose legacy, choose local, choose Wayside. Keeping it local since 1937.
A large fire and a possible explosion. You can see flames coming out of the top.
Stay away from floodwater.
Hundreds of thousands are still without power.
You can see there is a large police presence on Superior.
This tree uprooted.
Metro Parks Police, they are still here. They are still working.
Stream extended coverage on WKYC+. Download on your TV and watch for free.
Good morning, happy Wednesday. We do have some more cloud cover out there. Temperatures are going to struggle in the 40s for much of the day. We'll try to top out near 50 if we're lucky and get any kind of sunshine out there. Rain will be developing as we go through the morning. Scattered lake showers will be with us through the day. We'll also have some blustery winds gusting over 30 miles per hour at times. We're going to see the winds and the rain chances stick around overnight into Thursday. Some of that lingers into early Friday, and then we do look to improve in time for the weekend.
Oh. I'll talk to her after. You should see it. I got a microphone up here behind you.
Hi, nice to meet you.
Check, check, 1, 2, check, check, 1, 2. Mic check for press, mic check for press. 1, 2, 1, 2. Checking back at the studio. He's good. Can hear in the back. There we go.
Thank you for this. So, Captain, my captain.
All right. Yes.
Good morning. Welcome to the Village of Healing Center. On behalf of my entire staff and all of the patients that we are blessed to serve in these walls every single day, we just want to say thank you so much for coming out. I want to acknowledge, of course, all of our elected officials that are present today, Councilman Blaine Griffin, Councilwoman Deborah Gray, and County Exec Chris Ronayne, and of course, State Representative. Thank you. Here at the Village of Healing Center, we are blessed and honored to be able to serve the Black community every single day. We are a healthcare center committed to decreasing disparities and improving outcomes in the Black community. How do we do that? Simply by having a shared lived experience. We are different, we are strong, and we are blessed to be able to be Black providers taking care of Black patients every single day. And the reason being is for reasons like today. We know that when something comes out that affects healthcare, the first people that are going to be affected every single time is the Black community. And so the Village of Healing Center since 2022 has been committed to ensuring that our community continues to receive culturally sensitive, excellent health care. And we're able to do that through our women's health, through obstetrics, gynecology, primary care, and mental health. So again, thank you all so much for coming. We are honored that you are blessing our walls, and thank you for being here.
Thank you, thank you, thank you, thank you, Dana. And good morning, everyone. Good morning, everyone. Thank you, thank you, thank you, thank you. I'm really honored to be here at the Village of Healing and so appreciative of the work that you do to advance the health of Black women and the people in this neighborhood. Thank you all for joining us for this important press conference about the devastating Affordable Care Act and Medicaid cuts headed this way. And here with me, we have people who can talk about this from every angle. Starting with County Executive Chris Ronayne and David Merriman, Director of Health and Human Services for Cuyahoga County. We reached out to them to talk about this event, and when we did, there was no hesitation. That's because the county executive and our entire county leadership truly share our commitment to a healthier and more equitable Northeast Ohio. I'd also like to recognize Dr. Arthur Lavin and his colleagues from Doctors Organized for Healthcare Solutions for being here. Finally, we also have 3 other very important speakers with us. Ms. Griffin from University Heights, Ms. Lee from Lyndhurst, and Ms. Sulzer from Shaker Heights. They're all facing either major cost increases on their ACA plans or the potential loss of Medicaid coverage for their family. I am so thankful they could be here this morning because at the end of the day, it's not about me or our county executive. It's about the people, and the people need to be heard from. I want to be very clear about why we're here and what's at stake. The Trump administration is creating a healthcare crisis in Northeast Ohio. Trump's cup to the Affordable Care Act and Medicaid are a 1-2 punch that is going to punish everyday people. This Republican healthcare crisis will mean higher costs, fewer people insured, and more people sick in our community. And today, I am standing with my constituents to fight back. Our message to the White House and to the Republican-controlled Congress is very clear. We need to cancel the cuts, lower the costs, protect health care, and reopen the government. So, what has been their response? No negotiation and no compromise. The House hasn't even taken a vote since September 19th, y'all. Democrats have been on duty while Republicans have been on vacation for over a month now. To me, this is unacceptable. So let me spell out what they are trying to do. Republicans want to end enhanced premium tax credits for Affordable Care Act marketplace plans and enact the largest cuts to Medicaid in the history of the program. That will mean higher costs for people on private insurance, higher burdens for people on Medicaid, and ultimately, thousands of people in Cuyahoga County losing their health care. A staggering number of people will be impacted and the costs will be real. In Cuyahoga County, more than 50,000 people are on the Affordable Care Act marketplace plans. It's actually closer to 56,000 people. Nearly every one of those folks will see their premiums increase if the tax credits expire. And nationwide, the average price increase will be $700 a year. But for families and older people, the increase will be even more. We ran the numbers for a typical family in my district. A family of 4 in Cleveland, 2 adults in their 40s, 2 kids ages 8 and 10, with a household income of $56,000 a year. Their premiums are going to double. The family of 4 is going to see their premiums jump from $2,400 a year to $4,800 per year. That is money people do not have. And I am incredibly worried about what will happen and the terrible choices that people will have to make. People will have to figure out how to pay rent, pay for insurance, pay the heating bill, and keep food on the table in an economy that is already entirely too expensive. And a lot of people won't be able to do that. To add insult to injury, starting next year, the Trump administration begins the $1 trillion in cuts to Medicaid, along with work requirements. Let me tell you, these work requirements are immoral, unnecessary, and wrong. And they're going to be a huge burden on people. The goal is not to encourage work, because the reality is most people on Medicaid already work. The goal is to tie people up in red tape and kick people off Medicaid, plain and simple. When the Nonpartisan Congressional Budget Office ran the numbers, they estimated that over 17 million people, 17 million Americans, could lose their health care because of this double whammy. In my district, over 43,000 people are at risk of losing their health care. Now, I know I've thrown a lot of numbers at you, but to sum it up, in Cuyahoga County, we're talking about 50,000 people paying more and 43,000 people losing coverage. That is unacceptable to me. And that's why I stand firm, 10 toes down and shoulder to shoulder with the people I represent. The time is now. We need the other side to listen to the people. It's time for them to listen to families, listen to doctors, and listen to local elected officials. It is time for President Trump to work with us to reopen the government, lower health care costs, and cancel these cuts before it's too late. And with that, I want to hand it off to my friend and partner, County Executive Chris Ronayne.
Thank you, Congresswoman Shontel Brown, and thank you for your active work in this district. When the federal government is closed, you are working in our district, and we appreciate it. And I want to say to my colleagues, Council President Blaine Griffin, Councilwoman Deborah Gray, Councilwoman Meredith Turner, we too are working. Our governments don't shut down at a local level, and we need to continue to work for our people. And these are unprecedented times as it relates to our citizens and their vulnerabilities as it relates specifically to health care. We are proud to join you today in this message to our nation to be kind to its people. It wasn't too long ago in this country and in this state that a Democratic president and a Republican governor worked together to extend Medicaid to over 100,000 persons in this county and over 800,000 persons statewide. That was President Barack Obama working with Governor John Kasich. We need to get back to the days when across the aisle people work for the wellness of their people, regardless of party, partisanship. This is about wellness, and this is about all of us. Congresswoman raised the numbers, and when you take the entire Medicaid population, it's an even higher population. Our Medicaid population has been well served in this county for years. Persons who simply need health care to keep their families well and to keep working. In Cuyahoga County, the number of persons on Medicaid number more than 300,000 people, which is more than a quarter of our county. I could get into discussions also about supplemental nutrition assistance programs for our kids and our families, but that's for another press conference. But the health and wellness of our people depends on the basics of health care and food. And if you add up in both cases, Medicaid and SNAP benefits, over 50% of those served by those two important federal programs, over 50% are seniors and kids. We need to keep that safety net strong. Every person, no matter their zip code, income, or background, deserves access to quality, affordable health care. In Cuyahoga County, when our neighbors can't afford to see a doctor, I want to thank the doctors that are here today, the patient advocates, the nonprofits. Thank you, Dana, for this incredible organization, the Village of Healing, for what you do to help people with medical needs, no matter their insurance coverage. But out there, when they can't afford to see a doctor and when parents must choose between paying the rent and paying for a prescription, our entire community suffers. This is absolutely a reckoning moment for our country. No citizen should make a decision between paying rent or transportation or housing costs versus the medical needs that they have. The Affordable Care Act and the Medicaid have been lifelines for thousands of families here. More than 300,000 people, as I referenced, in our county rely on Medicaid. That's approximately 1 in 4 of our county residents. We're talking again about seniors, about children, about veterans, about people living with disabilities. But today, those lifelines are being threatened by our federal government unnecessarily, with cuts to Medicaid and attacks on the Affordable Care Act, and the politicization of that very safety net. These aren't just numbers on a spreadsheet. These are people losing access to health services, to mental health services, to prenatal care, to addiction treatment and preventative care. It will lead to emergency rooms filling up because people have nowhere to go. When we strip away health care, we don't just hurt individuals. We put a strain on our hospitals. We weaken our workforce, and we drive up costs for everyone. It was a day when people saw that across the aisle, that health care was good for the workforce, that it helped our economy, didn't hurt it. It helped our families. We put them on a path forward. But today, our federal government is setting our families back. And when our families get set back, our communities get set back. As I said in our State of the County address last week, we are not sitting on our hands. We are gearing up. I'm glad to be joined also by Kevin Gowan, Department of Job and Family Services today. Again, Councilwoman Turner, and our many members of Cuyahoga County that are here gearing up to help families in need. We're fighting to protect access, to strengthen our safety net. And there's no greater collaboration than with you, Congresswoman Shontel Brown. Thank you for being a federal leader that gets it and that works while the government is shut down, because you know our communities can't shut down. We'll work together to strengthen our safety net, to expand behavioral health services, and invest in programs that keep people healthy and working. But this work is hard without our traditional partners at the federal government and the state of Ohio, who's also triggered in Medicaid cuts in the future. We need them to hear us. Healthcare should not be a privilege, it is a right. Every time we defend that right, we move closer to a healthy Cuyahoga County and a healthy state of Ohio and a healthy nation. Our county that lifts people up instead of leaving them behind, that's our goal, working with you. I firmly believe the measure of our compassion is not in what we cut, but what we choose to protect, and we need to protect Medicaid. I want to thank you again and appreciate the advocacy of this group in this room and our citizens all throughout Cuyahoga County who understand that a healthy Cuyahoga County starts with health care. It starts with a safety net that cares about people. We will never give up on that. So this public-private nonprofit partnership that's in front of me today with our elected leadership, with our nonprofits, with our doctors and our patient advocates and our citizens who have each other's back. We are Cuyahoga. I thank you for your advocacy for a healthier Cuyahoga County always. It's my privilege to bring up our Health and Human Services Director, who's working very hard these days, David Merriman, to give a few remarks. Thank you, David.
Good morning. I want to add my thanks to Congresswoman Brown for gathering us here today. I know that federal legislation is more than just words to Congresswoman Brown. She knows that the impact of these laws are on children, on seniors, on disabled adults, and on the working poor. That is who we're here for today. And as we describe these programs, I'd ask you to think about that person in your life that you know occasionally needs a hand. That's who we're here talking about today. House Resolution 1 does many things to people, but today we're here to talk about its impact on Medicaid and the new work requirements that will be imposed on some residents, as well as broader eligibility requirements that will impact nearly 100,000 residents in Cuyahoga County. They're called work requirements, but really they're a paperwork hurdle that are put in front of families and adults who are just trying to get better. This will mean that every 6 months, residents are required to renew their paperwork just to keep their medical coverage. For those that are working or in a training program, that means they leave their job. They step away from their training program, they get on the phone, and they just wait because the volume of calls will be dramatic. This is big government that is going to get in the way of people's busy, busy lives. Just having to go through the hassle will mean that nearly 30,000 people will risk losing health care coverage, insurance they need to manage their family's health and their own, just so they can work and take care of their family business. Medicaid is a work support strategy that the working poor count on. We know that, and we see that every single year. And let's also think about that 98,000 residents. These are our neighbors. For many of us, these are family members that don't just miraculously get better when they get sick. Often, they end up getting sicker, needing more expensive care, and showing up in our communities, hospitals and clinics. These hospitals and clinics are already spread thin. This will shift the responsibility for them to figure out how to pay for the care. I look to my colleague, Councilwoman Meredith Turner, and County Executive Chris Ronayne. We have great services here in Cuyahoga County because of the voters of Cuyahoga County, but our social service system, senior adult services, children and family services, adult protective services, child support services are already on tight budgets. Will we make the decision to use our resources to fill the gap that will be left as these cuts are impacting or are implemented? Or will we help the homeless get housing? Will we help a person get on a path when they're returning from prison, a path to sustainability? Will we fill the gap that is created as federal dollars are pulled back, or will we offer high-quality universal pre-kindergarten? What will we do? These will be the choices that are thrust upon our community. In Cuyahoga County, we care about all families and neighbors. We're committed to coming together to respond to House Resolution 1 and find the best ways for us to serve and meet the needs of our friends, our neighbors, and those who have the greatest needs. Thank you very much. I'd like to turn it over to Dr. Arthur Levin.
Good morning, everyone. So I just want to take a moment and say how blessed we are to be here in the Village of Healing Center. And we're talking about healthcare. Healthcare is a word I don't think that carries the weight it should. I think healing's a great word. I think staying alive is a great idea. And all those are under threat right now. But we have hope in the room because Congress is here with our Congresswoman Shontel Brown. The county is here with our county executive, head of HHS. The city of Cleveland is here with the council and council president. And what I want to say today is that I'm proud to stand here today with my fellow doctors, with a group called Doctors Organized for Healthcare Solutions, DOCS. I mentioned DOCS because in 2010, this organization was responsible for helping turn the vote of a key vote that passed the Affordable Care Act. We've been fighting to save lives for all this time. And from the day the ink dried on that bill, the Republican Party has been consumed with tearing it down. And I don't know why they are so caught up with threatening all of our lives. But they are. And here we are again. They failed to repeal it. Now they're trying to smother it. And we talk about tax exemptions and things that I think are very hard to understand. But when it comes down to it, we're talking about cutting 24 million people off of health insurance. And let's get real about what that means. Because, you know, if you have trouble getting insurance for your house or car, that's one thing. But health insurance is a totally different thing. It's not really insurance. So bear with me, join me for a moment on a little journey on what this really means. If you can't pay for health care and you have diabetes, that means you won't get insulin. That means you could go into coma. That means you could die. If you can't afford cancer therapy, that means you won't go chemotherapy or the surgery you need to live. And that means a life of suffering if you live. This is personal for me. I was diagnosed with prostate cancer about a year ago, and it turned out the cell I had is a killer cell. If it wasn't removed, it would kill me. If I didn't have the money to remove it, I would be dead. And so when Congress acts, when the White House acts to try to tell people they will cut you off from care for that cancer, that hurts. That hits me personally. I think it's hurt every one of us. Think about heart disease. If you have a congestive heart failure or you're recovering from a heart attack, you need medications for your heart to function. Who of us can function without our heart? Cut off those medications, and those people die. And then we think about not just death, but think about asthma. In the United States, it costs a lot of money to get those inhalers. That's another topic for another press conference. But without money, you can't get those inhalers. And I can speak from personal experience from there too, because I have asthma. I remember nights when I didn't have access to inhalers, thinking I would die that night, suffocating. That's the life of asthma without the medicine. Our government is taking steps to cut people off from their breath. And I can't live with that. We are declaring a medical emergency that Doctors Organized for Healthcare Solutions. The GOP MAGA Trump administration have directly placed our nation into a healthcare shutdown. Not a government shutdown, a healthcare shutdown. That's what this is. And America's doctors say it must stop. We must restore the ability of Americans to get care. No American should die for lack of insurance. And no American should go broke for getting sick. Thank you. And now we're going to hear real stories from real people, starting with Ms. Griffith. Thank you. University Heights resident facing cost increases.
Thank you for inviting me to be here, Rep. Brown.
Good morning. I had to retire earlier this year, a year earlier than I was expecting to take care of an aging parent. My spouse is already retired, so couldn't get health care that way. Did COBRA for 1 month. It was exorbitantly expensive. So thankfully, we have the Affordable Care Act marketplace, and I was able to get a plan there that meets my needs. Now, with this stipend potentially going away, my rates could go from $200 something a month out of pocket to $1,200 a month out of pocket. I'm unemployed. My spouse is retired. That's a ridiculous amount of money that will greatly impact myself, my family, my ability to do what I need to do to care for my parents and so forth. Healthcare should never be a political football or a political issue. I consider myself an independent politically. But the fact is, people from all political walks of life, all political parties, all political walks of life, are on the Affordable Care Act. And as was mentioned before, there are 26 million of us that get this stipend, and I'm one person, a 26 million that could be hugely impacted if these are taken away. And I hope that people will listen to the messages of how this is impacting people and that they will think not about politics, but about people. Thank you very much. I'd like to introduce Ms. Lee.
It's really expensive to be poor. When I'm an artist, when the cruel bill giving our hard-earned money to the richest people in the U.S. who do not need it was becoming a reality, I have been terrified about my health care costs going up next year. Since moving to Ohio over a decade ago, I've relied on the marketplace for my health insurance. It used to be wonderful, truly affordable, with excellent coverage. As Republicans chipped away at our benefits, which should be afforded every American, I saw premiums and deductibles go up, networks shrink, and less things covered. However, it still covers a lot of life-preserving prescriptions and doctor's visits that I need. Because I know my subsidies are at risk, I've been taking on over double the work that I usually do as a self-employed individual, which is detrimental to my health. Because of the extra work I've had to take on, I've not been able to focus on the important work central to my practice as a culture bearer. I have also had to pay out of pocket for health care that sustains me through ongoing autoimmune and disabling conditions, and have resorted to leaving the country for medical care where it is more accessible, humane, civilized, and speedy. I'm amazed at the lack of imagination that this administration has, and that it lacks the ability to imagine how taking care of its people, all of us, could improve and strengthen the U.S. The anger that I have at not being properly represented keeps me up at night. Humane and economically sound policies being rolled back in favor of disastrous, expensive, and malicious ones block my rights to life, liberty, and the pursuit of happiness. I'm infuriated by Republicans who do not understand or care that affordable and accessible healthcare coverage keeps us healthy, keeps us contributing to the economy, and reduces the burden on our already tattered and fraying healthcare system. Our system has been crippled by unsound and mean government policies. The good people in the system are not to blame. They are doing the best they can with their hands tied. Not sure why, in a supposedly developed country, you'd want to tie up doctors, nurses, techs, when they are the essential workers and backbone of our society. We should pay them and support them more and let them do their job. No one without a medical or science background should be making decisions or telling medical professionals how to do their jobs. Republicans have made it crystal clear for years in all of their policies, words, and actions that they want us to die or stay feeble enough to be their labor force and tax base, but not demand and fight for our rights, while they do zero work and taunt us because they've completely lost touch with their humanity since they've been bought by more sinister interests. I applaud Congresswoman Brown for standing up for us, the regular people who far outnumber the tyrants who would rather have our entire economy and country collapse than do their job. I fully support her ability to imagine a better country and her understanding of what it means to be a public servant, to serve the people. We are not here to serve the public servants. They are here to serve us. Thank you so much. I want to introduce Lindsay Selzer from Shaker Heights.
A parent's worst nightmare came true for me about 5 years ago when my daughter Livy suffered a tragic accident. A week before her 4th birthday, Livy was playing in our backyard with her 2 brothers when a tree branch fell on her, knocking her unconscious. She needed emergency brain surgery, followed by 5 months in hospitals. The Livy we knew was gone. The one who came home wasn't fully conscious. She couldn't walk, talk, or eat on her own. She went from being a mischievous ham who loved performing and hiding under the bed sneaking snacks to a kid who required full-time attention and assistance to survive. A Medicaid waiver covered the nursing, medical equipment, supplies, and other support she needed. Despite significant progress, Livy's disabilities still require extensive care, and a Medicaid waiver provides what she needs to live at home and participate in school and her community. Medicaid covers things that private insurance does not, such as a bath chair and a ramp for Livy's wheelchair. We didn't think we'd ever need a service like Medicaid, but without it, Livy's medical expenses would have sacrificed the financial future of our family, and we would be unable to care for her or be the best parents we can be to all our children. Medicaid cuts would gut the programs Livy relies on. Because they are not required by the federal government, state budgets consider them optional, and they'll be the first on the chopping block. Already, states like North Carolina are cutting Medicaid in anticipation of these changes, and as a result, kids aren't getting the health care they need. Livy is so full of joy and love. She's an incredibly expressive girl who always lights up when her caregivers show up and is beloved in her community, where she deserves to live and thrive. What happened to Livy could happen to anyone. We need Medicaid to be there for them when it does. I'd like to turn it back to Representative Brown.
Thank you all so much for being here. And thank you especially to Ms. Griffith, Amy, Lindsay. Thank you so much for sharing your stories. And you just have to admire their strength and their willingness to come forward. Before we close and open it up for questions, I want to make one final point. The ACA, the Affordable Care Act, enhanced premium tax credits have been a huge success. I voted for these credits back in 2021 in the Inflation Reduction Act, and they have helped millions of people afford health care. In Ohio, we saw the number of people on ACA plans more than double since 2021. Similarly, thanks to the Affordable Care Act, we expanded Medicaid for people in need and brought the uninsured rate to historic lows. Those are big wins, and we should be building on that progress, not reversing it. And that's what really upsets me. These cuts to Medicaid and the Affordable Care Act, they're not being done by accident. These cuts are being made to pay for tax cuts for the ultra wealthy. That's why I call this reverse Robin Hood. Trump and his allies are lighting the safety net on fire to keep the country club warm, y'all. But there is still time to do something about it. That's why I'm joining my Democratic colleagues in Congress to fight these cuts and lifting up the voices of people in Cuyahoga County. Our message is simple. Cancel the cuts, lower the costs, save health care. That's what this is about. Cancel the cuts, lower the costs, save health care. Thank you all for being here, and now we'll answer your questions. Well, that is what we're fighting for. Notices go out this month for some across the country, and we know that open enrollment starts November the 1st. That's what this fight is about. We understand the severity of what will happen if these tax credits expire. You've heard testimony from people right here in Cuyahoga County who have expressed the importance of having these tax credits and how they are saving, literally saving lives. It is on Donald Trump and the Republicans to reopen the government, stop this shutdown, lower the costs, cancel these cuts, and to save our health care.
I'm sure you've heard, I don't need to tell you the Republicans what they would say. They're going to say that this is something that was put in place, the tax credits, during COVID, and like many things that happened during COVID, they should expire, if you will. What do you say to that?
I say that the 43,000 people in my district who depend on them can't afford to let them expire. This isn't about COVID. This is about saving lives and continuing the success under these plans that have been demonstrated clearly, again, by people who live and didn't expect that they would need to be on programs like this. So these are lifelines. And while my Republican colleagues see them as line items, Democrats are ensuring that people we represent, and surprisingly, over 75% of Republican constituents who benefit from these tax credits agree with us.
Also, COVID's not over, and that's their fault.
And at a time when they're cutting positions, we are in the midst of Trump continuing to threaten to terminate people at the CDC right at the season of COVID and flu viruses and respiratory infections. So this is on them. I will remind folks in this room what they have been reminding us since January 20th. They have the House, the Senate, and the presidency. This is on them. Sure.
So I think the key word in your question is the word expire. And the question is, do we want the tax cut to expire or people to expire? You know, that's what, someone's going to expire. And we found a path in this bill to help 24 million people. Now that we found that path, can the American public really support cutting off health care to 24 million people? That's the expiration that the doctors are concerned about.
The other thing is, it started during COVID, but how many great things have come out of that, especially when it comes to healthcare. Telehealth came out of COVID. So people that were unable to go to their appointments, we have elderly, seniors, things like that, people with no transportation that have been unable to get health care all of this time because of COVID, and telehealth coming out, are now able to go to their appointments. Now, due to the shutdown, Medicaid and Medicare patients, those same seniors that are now in the best health that they've ever been in, are not able to get to those appointments. So now we're trying to figure out, how do we get them back in? How do we get them back into their appointments, get them back on track with their medicines, and get them back into the best health care they've ever had?
I would, on the question of the tax credits, taxes are an instrument of social policy, and the tax cuts will demonstrate that this is a cut to people's health care and to their lives, as the doctor said. So I would continue to encourage persons to reach out to their local congressional districts, with applause to our Congresswoman for what she's doing. But as every congressperson in America should know, the power of the people is stronger than the power of the president. And the power of the people shall prevail if people continue to lobby and advocate for the restoration and the continuation of these tax credits. And for Medicaid generally, it has been the backbone and the safety net of the middle class and of those who have lesser means to keep them healthy. So we've got to speak up. And that's why we're here today and proud to join Congresswoman Shontel Brown. We also encourage people who have found a path that they fall off the path to call us at the county Department of Health and Human Services. They're working hard every day. I would also say to our legislators out there, visit places like the Village of Healing, visit our FQHCs, visit our hospitals. Go see what we've put on their shoulders. All of this rolls downhill as our council president council members, county council members, and our county staff know, this falls on our shoulders now. Every cut in Washington rolls downhill to the local communities, to local families, and to individuals. So speak up. Thank you.
Thank you. Oh, you have a question?
I just wanted to ask, do you have any sense of what benefits like SNAP with clinics will go out in November, and how do you kind of balance the needs of opening the government with your
So it's a great question. We are not clear. We do know that there has been, there is a stipend, and we see that the administration, specifically Donald Trump, is talking about reshuffling resources, but we want that not to be an issue. We want those things to no longer be an issue. They can open up the government today. They can stop this shutdown right now. And so we're going to continue to fight this until we win. But be clear, I'm going to do everything that I can to ensure, as a person who started in local government and then went to the county and now a member of Congress, that we protect our constituents who are in the most need. So thank you. Thank you all. Thank you everyone for being here.